Welcome back. Now to a health alert this morning. A new study showing half of heart attacks are happening to people who are told that they are low risk. That study is coming from Mount Sinai. Here to unpack the study and help us stay heart healthy is Dr. Bradley Taylor, Chief of Cardiac Surgery for Baptist Health Heart and also Vascular Care. Welcome, Dr. Taylor. Thanks for being here with us. So talk a little bit more about the findings of the study. Why are people who are being labeled low risk still experiencing heart attacks?
Sure. So this study was a retrospective study where they looked back over the last 5 years, and they noticed that we have these risk calculators that they can use to predict the likelihood. And about half of the patients who are actually having MIs were deemed to be low risk over 10 years. The fidelity of these risk calculators, they really only look at 5 factors. And coronary disease is more complex than what really comes into those 5 factors. And so there's more to it than just whether you have diabetes, what your age is, whether you have a smoking history, and what your cholesterol level is. And so what it identifies is that you may be deemed low risk, but you still are at risk is the best way to put it.
So for people that maybe are watching this morning and have been told they're low risk, what should they be looking out for? What should they do right now?
So the most important thing is actually your family history. I think it really calls into question. You know, genetically, and who we are, you know, it reflects upon we, in many respects, become our parents, both in our health conditions and in our personalities. And so if you have a positive family history for coronary disease, your likelihood of having a coronary event, particularly if your parent was less than 55 years of age, you're at 2 to 3 fold increased risk of having a coronary event at a young age.
Can you explain silent plaque to us and how it plays a role?
So one of the things that came out of that study was that we all have silent plaque, and as we live our lives, we start to develop atherosclerosis. You can actually identify it very early on in childhood, and it grows or continues on as we age. And the issue related to chronic plaque or vulnerable plaques is it's a sign of inflammation. And at any point in time, somebody may have that plaque rupture. And a lot of the patients that I identified were patients who had just that. They had plaque. Something happened within their body within a short time period, and that plaque would rupture, and they would then go to the hospital. Most of these patients had about a 48-hour window of some symptoms. Think about symptoms this way. Symptoms are a late warning sign for us. So if you become symptomatic, you need to present to the hospital.
So what can people do, I guess, to find out if they fall in that category?
So clearly you want to see your physician. You want to know yourself. You want to know your family history and relay that to your physician. And then they can use the risk calculators, and then there's additional things they can do. And if you are somebody who is borderline in deciding whether they need to be on a statin, whether you have one single significant risk factor, then getting an additional test called a coronary calcium score is a really good test to do.
So just talk to your doctor, right? If you think that you fall into any of these categories. How is this study just helping when it comes to future, I guess, heart diagnosis?
Well, again, I think it highlights it highlights both the physicians and to the public that they really need to be aware of what their potential risk factors are, and that there are tests that they can get to then better discern whether they need to be on specific medications, change their lifestyle, and then pay attention to their symptoms.
And just a friendly reminder for everyone out there about how we can keep our heart healthy. You just mentioned them: diet, exercise.
Well, certainly, the worst thing you can do is smoke, right? So if you smoke, you got to stop. If you do have diabetes, and some diabetes can be managed just by losing weight, there are ways to lose weight now that are extraordinary measures that have been incredibly impactful. And then being on an anti-cholesterol medicine or a statin has proven to be beneficial. But again, really knowing your family history and understanding that you're going to become your parents in many respects, particularly, or even, you know, other generations, your grandparents, you know, you can go back 3 generations. If you know that, you can really help yourself, and it helps your physician have more accuracy in predicting your likelihood of having an event.
All right, Dr. Taylor, thank you so much for your insight and all that great information this morning. If you want to watch this interview again or for more information, head to our website, WPBF.com. Stephen.
Well, an athlete